Hi everyone,
Hi.
welcome to today's episode. We are having a health talk, and I have a guest. Her name is Sandra, beautiful
Hi.
Sandra. Welcome
Thank
to my
you.
channel today. So Sandra here will be asking me some questions, and I'll be addressing those questions. Let's dive right in.
Okay. Hi everyone. So today I have this question I would like to ask your favorite pharmacist. So there is this talk that's been going on online most times about this ChatGPT. So now I want to ask you some questions concerning the impact of ChatGPT in our health. Okay, so our first question: what do you think ChatGPT is encouraging self-diagnosis and self-medication among the public?
Yes, that as a matter of fact, that's the trend right now. That's the trend right now. ChatGPT is encouraging self-diagnosis and self-medication. Okay, so why ChatGPT? It helps give a general information. It helps give a general health information, your well-being, healthy lifestyle, and all. Which is a good one, right? But at the same time, it's encouraging the masses to embark on self-diagnosis and self-medication. And mind you, ChatGPT cannot diagnose. ChatGPT would only give a general overview. So, yeah, it is.
Okay. How can this behavior be risky, especially in countries where access to health professionals are limited?
Okay, that's a very good question. Remember that I said that ChatGPT is encouraging self-medication and self-diagnosis. Now, in a country where access to healthcare professionals is limited, it's even more risky, because just imagine that you follow the instructions of ChatGPT, right? And now you don't get a good result. Matter of fact, your case gets worse, and the hospital is so far from your house. The closest hospital, the nearest one, is far from your house. Imagine how long it will take you to get to your hospital. That can even cost life. So it is actually not helping in
Okay.
that case.
Okay, thank you very much for doing well. So, question number two: what are the dangers of relying solely on ChatGPT or AI for health advice without the verification of any professional?
Okay, I think this is a very important question, because, like I earlier said, ChatGPT, it provides a general information, right?
Yeah.
But the thing now is that as an individual, ChatGPT doesn't know your past history. It doesn't run tests. It doesn't self-examine you to know exactly what what action to take. So it's basically going to give you a general overview regarding the prompt you gave it to take. Do you understand? So it's just going to give you a general overview. It's not going to self-examine and know your past history and all of that to
Yeah.
exactly know.
Unlike your doctors,
Yeah,
or this guy
unlike-
that knows your health
Yes,
history already.
yes. And aside that, a professional, which is a human being, has that ability
To communicate.
communicate emotionally. So it's not just about the whole idea of how do you treat this. It's about emotional communication, as well as self-examination and what not to do. Do you understand? So, just in summary, ChatGPT gives a general overview, while your health professional gives a personalized treatment approach.
Okay, it's like
Yeah.
you have okay. Let me ask, how can you share an example where this can lead to harm?
Okay, yeah, I think I have this example of, just imagine someone that has been coughing persistently, right? Someone that has been coughing persistently, and ChatGPT has been recommending medications to use for the cough. Let's say dry cough, and the person is using dexamethasone, or just whatsoever that ChatGPT recommends for that irritating dry cough. But then the cough is still persistent, not knowing that what is actually the problem there is tuberculosis.
Oh,
Right?
really?
So this, which is even on its own, is harmful, can lead to death if not properly taken care of. Right? Another instance is, imagine someone that is having chest pain, and then you ask ChatGPT what is the solution to this chest pain. ChatGPT will now come up with, okay, the major cause of that chest pain could be ulcer. Now you go and start treating ulcer
without
without
an
running a lab
underlying-
test, without. And then imagine if this is actually a sign of heart attack.
Oh,
So you see, these are instances where it can actually be detrimental.
okay. So our next question. I'm actually enjoying this talk. Hope you are.
Yeah.
Okay. So our next question. With AI providing so much information instantly, are people becoming less inclined to consult their doctor or pharmacy? What do you think?
Yeah, AI gives one reassurance. It gives one confidence based on the answers, and these answers, they are something that you can relate to as an individual. So it boosts your confidence. But the thing now is that the confidence can actually have, it can be a false confidence, in the sense that this is a general information that it provides to you, not based on your history, not based on diagnosis, not based on self-examination. So it's just giving you maybe something that is actually a medical emergency. It will just it will just give you a reassuring answer that this is what would work, whereas this is something that requires immediate emergency. Just like the past example I used of someone having a chest pain. Now this is a chest pain that is from heart, like that is linked to heart attack, but it's telling you that the cause of this could be ulcer, right? Now you're on ulcer medication with the full confidence that you've gotten your treatment plan.
Okay.
But when it is not.
Oh,
Yeah.
okay. So how does this shift impact treatment outcome?
Negatively.
Negatively.
It impacts negatively.
Yeah.
Because the treatment outcome, there could be wrong diagnosis, there could be wrong prescription, there could be wrong treatment plan, and no follow-up at all. So now these are where your medical professionals come in. Your medical doctor, your pharmacist has to follow you up and to know how well you're doing, and to even know whether or not to change your medication. And of course, your medical professional would streamline your treatment based on this a holistic approach: your physical examination, your medical history, your diagnosis, I mean the whole test, running test and all, which the AI lacks. Your ChatGPT lacks this, your Google lacks this, right? So it's just giving you a general overview.
Okay, so
Yeah, so it's-
unlike our professionals that knows about your chart history, your health history, and also follow your ChatGPT doesn't do things like that.
Yes.
Oh, okay. So that's interesting. So our next question: in your option, how can health professionals strike a balance between using AI like ChatGPT as a support tool without letting it override our judgments?
Okay, this question is an interesting one, because I use AI, right? I use AI for educational purposes. I use AI when I want to, make posts. I try to balance it all, to have a very good write-up,
Caption.
yeah, on how to, approach my audience in a more understandable way. Because AI uses relatable words, right? So now, but we as healthcare professionals, we balance this up by confirming we have our knowledge banks, we have our MDEX, we have Medscape. MDEX is the book, where you confirm medications, their drug interactions and all, right? So
Okay, just like a guideline.
yeah, just a guideline, exactly. So we need to balance it up with our clinical experience. We balance ChatGPT up with our clinical experience. We balance it up with the physical examination, with the diagnosis, and as well with our medical guidelines. Yeah, so we don't just rely on AI. We can use AI for educational purposes when we want to make posts and all, right? And also to see what the internet is saying about this. But our medical expertise cannot, it cannot be sidelined just because AI is telling us this.
existing, yeah.
Because these are things that we were taught in school, right? And even over time, we've practiced and we've seen what works and what really not works. Because sometimes theoretically it doesn't really yield exactly practically. It doesn't give So over time, with practice, you even get to know that, okay, I think in as much as this is what AI is saying, I think this is a better way to do this. Yeah.
So that's nice. So my final question: should there be a boundary between what AI should or shouldn't advise people? Like, should there be a boundary?
Yeah, I think there should. AI should just focus on giving general information on wellness, lifestyle, how to live healthy, the good diet and all. But AI shouldn't be relied on for diagnosis. AI shouldn't be consulted when you need an urge, when you need something that can actually determine your health, when it needs something that will determine life or death, something that determines life or death. You shouldn't rely on AI. So you should just focus on giving overall lifestyle, wellness, and that's it.
So that's nice. So fam, I will ask, what's your advice to your fans out there who rely solely on the advice AI gives to them, especially when it comes to the issue of health? Because I've seen this play out countless numbers of times. People walk in and tell us, give me this drugs, give me that drugs, and you ask them, were you diagnosed? They say no, it was from AI, this AI that. So what's your advice to people out there who depend solely on AI when it comes to their health?
Okay. My advice is always verify with your healthcare provider. Verify if this is actually what you need. Do you understand? So don't bring the idea of this is something I already know that I'm having, so give me this.
Okay.
No,
you don't just conclude based just on the symptoms.
Yes, don't conclude based on what AI gives to you. You have to verify with your health. As a matter of fact, you as a patient can actually help your healthcare provider by providing those information that AI gives. Do you understand? But you need to verify. Your healthcare provider has already worked with experience, and he or she is in a good position to advise you better than AI. Yeah.
Okay. So thank you very much. I'm actually very glad having you.
Yeah.
Or you having me.
Thank you, Sandra, for a wonderful session.
Thank you very much.
Yeah.
Goodbye.
Bye.